Welcome back, everyone, to the 21st Century Man podcast. As men, we often find ourselves juggling a lot. Work, family, hobbies, you name it.
It's a constant balancing act.
It really is. But amid all that hustle, it's easy to overlook something absolutely fundamental to our well-being, our circulatory health.
Couldn't agree more. It's the foundation for everything else.
And that's precisely why we're diving deep today into Chapter 13 of the 21st Century Man, a book that's become a bit of a roadmap for us on this podcast. This chapter is all about circulation, and the authors, Dr. Ingenio, a vascular surgeon, Dr. Brandeis, a urologist, and medical writer Nancy Fass, get right to the heart of the matter with the title. Circulation. Your life depends on it.
Yeah, when I first saw that title, I thought, okay, that's a bit dramatic. But the more I delved into the chapter, the more I realized how accurate it truly is.
It's one of those things we kind of take for granted, right? Like
Yeah.
our heart beats, blood flows, we go about our day. But this chapter is a real eye-opener.
Totally. It goes beyond just the basics and really breaks down why healthy circulation is so vital for men specifically.
So for our listeners tuning in, think of this deep dive as your shortcut to understanding this crucial aspect of your health. We'll unpack the key conditions they discuss, like peripheral artery disease, PAD, and deep vein thrombosis, DVT, and extract those actionable takeaways, stuff you can actually use.
Exactly. We'll cut through the medical jargon and get right to the heart of what you need to know.
Because knowledge is power, right? And when it comes to our health, being informed is the first step to taking control.
Absolutely.
So right off the bat, the authors hit us with this powerful quote. Perfect health depends on perfect circulation. I mean, that's a pretty bold statement, wouldn't you say?
It is. But as we go through the chapter, you'll see it's not hyperbole. They back it up with solid explanations and some pretty compelling real-life examples.
Okay, let's jump right in. Let's start with peripheral artery disease, or PAD. Now, for those who aren't familiar, can you give us the layman's explanation of what's happening in PAD?
Sure. Think of your arteries as the highways that carry oxygen-rich blood from your heart to all parts of your body.
Okay, I'm visualizing that.
Good. Now, in PAD, those highways start to get narrowed, and the culprit is usually plaque buildup.
So it's like rush hour traffic for your blood.
Exactly. It can't flow as freely, and this restricted blood flow, you usually see it in the legs and arms first.
Ah, so that's why some people experience pain or cramping in their legs when they walk.
Bingo. But here's the thing. It's not just about leg pain. PAD can also impact other vital areas.
Like?
Well, your brain, your heart, even your sexual health. Because remember, everything needs good blood flow to function properly.
Right, it's all connected. Now, the book introduces us to this guy named Bill, a golfer, whose story really brings PAD to life. What was his deal?
Bill, well, he was looking forward to retirement, picturing himself on the golf course all the time, living the dream.
Ah, the retirement plan for many.
But here's the catch. He started experiencing serious fatigue and leg pain, particularly when he was walking the course.
Oof, that's got to be frustrating.
It was, but what's interesting, and I think many listeners can relate to this, is how Bill initially brushed it off.
How so?
Instead of going to the doctor, he just started using a golf cart more, adapting to the problem instead of addressing it head on.
Yeah, that's classic avoidance.
Yeah.
Out of sight, out of mind, right?
Exactly. And the authors highlight that Bill's risk factors are pretty typical for men who develop PA.
Fill us in, what were those?
Well, he was getting older, which, hey, we're all doing that, right? But he also had a history of heart disease. He smoked.
Uh-oh.
Yeah, he'd gained some weight. And his physical activity had actually decreased because of the leg pain. It's kind of a vicious cycle.
It is, it is.
Yeah.
So what finally got Bill to see a doctor? I mean, was there a turning point?
Eventually, the pain just got too intense. It was no longer just a nuisance. It was interfering with his life.
I can imagine.
So he goes to his doctor, gets referred to a specialist, a vascular surgeon, and they do an ultrasound, a painless way to look at the blood vessels. And that's when they find the culprit. Plaque buildup, narrowing the arteries in his thighs.
Mystery solved.
But here's a nuance that I think is really important. When Bill was resting, his circulation was actually around 70% of normal.
Huh. So not terrible, you'd think.
Right. That's why he didn't have symptoms all the time. But when he was walking, exerting himself on the golf course, his leg muscles needed more oxygen.
Ah, and the narrowed arteries couldn't keep up with the demand.
Exactly. It's like trying to force a lot of water through a partially blocked hose. You're just not going to get the flow you need.
Makes sense. Now, I think some guys might hear this and think, okay, so it's leg pain, a bit annoying, but not the end of the world, right?
Mm.
But the authors are pretty adamant about the seriousness of PPA.
Absolutely. And this is a stat that's hard to ignore. Within 6 years of a PPA diagnosis, about half of men will die from a cardiovascular event.
Whoa, like a heart attack or stroke?
Precisely. So it's not something to take lightly. It's a major red flag that your cardiovascular system isn't in tip-top shape.
Okay, that definitely puts things in perspective.
Okay.
So after Bill's diagnosis, what were his options? What did the doctor recommend?
Well, they discussed a few approaches. Initially, the focus was on lifestyle changes, those things we all know we should be doing, but sometimes...
Let's be honest, we don't always do.
Yeah, those. So things like regular exercise, quitting smoking, that was a big one for Bill, managing blood pressure, getting to a healthy weight.
All the good stuff.
Yep. But in Bill's case, lifestyle changes alone weren't quite cutting it.
Meaning?
After a few months, the pain was still really limiting him. So they started talking about more direct interventions.
Like surgery?
Well, it could be. They discussed angioplasty using a balloon to open up the artery, atherectomy actually removing plaque, stenting, putting in a little mesh tube to keep the artery open, even bypass surgery, rerouting blood flow around the blockage.
Wow, so a range of options.
Yeah.
What did Bill end up choosing?
He went with angioplasty, a minimally invasive procedure done right in the doctor's office.
So no major hospital stay or anything?
Nope, just mild sedation, local anesthesia. And here's what I found fascinating. The surgeon actually told Bill that just 10 years earlier, he would have needed open surgery.
Really?
Yeah.
That's amazing how quickly medical technology is advancing.
It is. It's something to be grateful for.
Absolutely. So angioplasty, done, problem solved.
Well, not quite. Managing PAD, it's often a long-term commitment. Bill had follow-up appointments, occasional ultrasounds to keep an eye on things.
Okay.
And he started on a statin to manage his cholesterol, low-dose aspirin to prevent blood clots, and of course, he had to really stick with those lifestyle changes.
So it's a multi-pronged approach.
It is. It's not just a quick fix. It's about making sustainable changes for long-term health.
Makes sense. Now, the next section of the chapter, it's called The Secret Life of Arteries and Veins. And it's really a fascinating look at this intricate network within our bodies. What are some of the highlights?
Well, first off, they talk about the sheer scale of it all. Did you know that if you laid out all the arteries in your body end to end, they'd stretch for something like 25,000 miles?
25,000 miles. That's like circling the Earth.
Exactly. It's mind-boggling. And that just shows the incredible job your heart does pumping blood through this vast network.
Yeah, nonstop, 20/47.
And it's not just the heart doing all the work. The arteries themselves, they're actually active players in moving blood along.
Also.
Their walls, they contain muscle and stretchy connective tissue. So when your heart beats, they expand and then they recoil, helping push that blood further along.
So it's like a second pump.
In a way, yeah. It's a beautifully orchestrated system.
And the inner lining of these vessels, I think they call it the intima, that plays a crucial role too, right?
Oh, absolutely. The intima, it's lined with these special cells called endothelial cells. And they do some really important jobs.
Like what?
Well, first, they create a super smooth surface. So blood can flow easily, no friction. But they also help prevent clots, inhibit plaque buildup, and even regulate blood flow. It's pretty remarkable.
It is. And as the arteries branch off into those tiny capillaries, that's how oxygen and nutrients get to every single cell in your body, right?
You got it. And at the same time, they pick up waste products.
No.
It's a constant exchange, a two-way street.
And it's happening all the time without us even thinking about it. Amazing.
The human body is a marvel. Now, the book then contrasts arteries with veins. And there's a key difference in how they work.
Lay it on us.
So blood needs to get back to the heart, right? And that's where veins come in. But unlike arteries, veins don't have that thick muscular wall to pump the blood.
So how does the blood make its way back uphill, so to speak?
Well, it's a bit ingenious, really. It relies on our muscles and a clever valve system.
Intrigued. Tell me more.
Your leg muscles, especially in your calves and thighs, they act as pumps. Every time you move, walk, flex your feet, whatever those muscles, squeeze the veins, pushing blood upwards.
So being active is literally helping our blood circulate.
Big time. And to prevent that blood from flowing backwards, veins have these one-way valves. They're like little doors that only open in one direction.
Ah, so the muscles push the blood up and the valves make sure it doesn't flow back down.
Nailed it. But here's the catch. Our modern lifestyles, they're often not conducive to this system working optimally.
Meaning?
We sit too much. We're not moving nearly as much as our ancestors did. And that lack of movement, it creates a sort of mismatch for our physiology. Our bodies are designed for movement.
So we have to be more intentional about incorporating movement into our day.
Exactly. Even little things, taking the stairs, walking during lunch breaks, just getting up and moving around regularly can make a big difference.
Okay, good to know. Now let's circle back to PED for a moment. How does it typically progress, and what are some of the signs to look out for?
Well, the book uses a great analogy. They compare it to a car accident on a highway.
I like analogies.
Me too. They make things easier to understand. So just like one accident can cause a huge backup, a blocked artery can seriously disrupt blood flow.
Makes sense.
Now, they talk about chronic versus acute insufficiency.
Difference being?
Chronic, that's like the slow buildup of plaque over years. The artery gradually narrows. Acute, that's more sudden, like a piece of plaque breaking off and lodging in a smaller vessel.
So like a sudden road closure.
Exactly. Now, symptom-wise, the most common early sign is what's called claudication.
Claudication.
It's basically pain that comes on with exercise. You know, those arteries are narrowed, so when your muscles need more oxygen, they can't get enough.
So it could be pain, cramping, fatigue in the legs.
Right. And it usually gets worse with activity, then eases up when you rest.
Okay, that's good to know.
But as PAD progresses, you might start getting pain even at rest. That's called rest pain, and it's a sign that things are getting more serious.
Not good.
No. And because circulation is compromised, you might also notice things like slow healing sores, especially on the legs or feet, and cold hands and feet.
Because they're farthest from the heart.
Exactly. Now here's the kicker. Many men have PI'd with no symptoms at all.
Seriously.
Yeah, it's often called silent PID. And that's why it's so important to be aware of those subtle signs.
Like the ones we just discussed.
Exactly. So if you have sores that aren't healing, leg pain after minimal exertion, or chronically cold extremities, don't ignore it. Talk to your doctor.
Solid advice. So how do they typically diagnose PI?
Often, it starts with a simple blood pressure comparison. They'll check the pressure in your ankle and compare it to the pressure in your arm.
If there's a big difference, that's a red flag.
It can be. And then to pinpoint the problem, they might do an ultrasound, get a clear picture of what's happening in those blood vessels.
Now, on the prevention front, is it similar to preventing heart disease?
Very much so. Stopping smoking is absolutely crucial.
Right.
Managing cholesterol, often with medication, keeping blood pressure and diabetes under control, and sometimes taking a low-dose aspirin to prevent clots.
All good things to be mindful of.
Yeah.
Now, what if someone already has PAD and it's pretty advanced? Are there surgical options?
There are. When blood flow is severely restricted, they call it chronic ischemia, and it can be quite serious.
Maybe.
It can cause severe pain, even tissue damage, and in some cases, surgical intervention is needed to restore that blood flow.
Okay.
Nowadays, many procedures are minimally invasive, like angioplasty. They go in through an artery, usually in the groin, and use a tiny balloon to widen the narrowed area.
Ah, like what Bill had.
Exactly. And sometimes they'll also insert a stent, a little mesh tube, to keep the artery open.
Okay, that makes sense.
For more complex cases, they might need to do bypass surgery. They'll create a detour for the blood flow using a graft from another part of your body.
Fascinating stuff. Now, let's shift gears and talk about deep vein thrombosis, or DVT. This is another one that can sneak up on you.
Oh, definitely. The book tells the story of Bruce, a businessman, and it's a real wake-up call.
Tell us about Bruce.
So Bruce, he's a healthy guy, relatively young, no family history of heart problems. He's just finished a big business trip to Shanghai, feeling good, celebrating a successful deal.
Living the high life.
Right. On the long flight back, he enjoys a couple of drinks, falls asleep, wakes up, feels some discomfort in his leg, but figures it's just from sitting for so long.
Easy to dismiss, right?
Yeah, we all do it. But as he's heading to catch his Uber, his leg feels heavier, almost swollen. Then, boom, during the Uber ride, chest pain hits, shortness of breath. He's thinking, this is not right.
Oh, man, scary stuff.
It was. Luckily, he tells the driver to take him straight to the ER.
Good call.
Lifesaver, really.
Yeah.
The triage nurse, she immediately recognizes the red flags. Swelling in his leg, recent long flight.
Uh-oh.
Yeah, she suspects a pulmonary embolism. That's when a blood clot, usually from the legs, breaks free and travels to the lungs.
And that's life-threatening.
Potentially, yes. Blocking blood flow to the lungs, it's a big deal. The nurse's quick thinking, it likely saved Bruce's life.
Wow, that's incredible. So what happened to Bruce? Did he make a full recovery?
He did, but it wasn't a walk in the park. He spent a week in the hospital. They even put in a vena cava filter, a little device to catch any more clots before they reached the lungs.
So this wasn't just a minor episode.
No, it was serious. And it turned out Bruce had an underlying genetic clotting disorder, which made him more susceptible.
Ah, so even Seemingly healthy people can be at risk.
Exactly. And here's the sobering stat. About a quarter of men who have a pulmonary embolism, they die suddenly. It's more common than people think.
That's frightening. So what are some of the risk factors for DVT? Besides genetics, I mean.
Well, age is a factor, unfortunately. The older we get, the higher the risk.
Great.
Family history plays a role, obesity, smoking.
Those usual suspects.
Yep. And then prolonged standing or sitting, those can contribute too. Basically anything that slows down blood flow in the legs.
Okay. Now, what about signs of poor vein circulation in general? What should we be looking out for?
Swelling in the legs and ankles, that's a common one. Changes in skin texture, dryness, peeling, a shiny appearance.
Interesting.
Discoloration of the skin on the feet or toes, brittle toenails. In severe cases, even ulcers, especially around the ankles.
So our legs are trying to tell us something.
They are, and it's important to listen.
The book also explains how vein problems can worsen over time. Can you elaborate on that?
Sure, so inside our veins we have these little valves, right? They keep blood flowing in the right direction. But if those valves get damaged, blood can start to pool, flow backwards.
Not good.
No. It increases the risk of clots, which is the thrombosis part of DVT. And it can also lead to varicose veins.
Those bulging veins we sometimes see.
Exactly. So it's a cascade of events, really.
Okay, so what are some specific things that can trigger a DVT?
Prolonged immobility, like a long flight or bed rest, recent surgery or trauma.
Ah, so Bruce's flight to Shanghai.
Bingo. Obesity, heart disease, vascular disorders. Even some orthopedic surgeries, like hip replacements, can increase the risk.
And what are the key symptoms of an acute DVT? The kind that sends you straight to the ER?
Sudden swelling in one leg, pain or tenderness, warmth, redness. Usually just one leg, that's important to note.
Okay.
And of course, any sudden chest pain or shortness of breath, that could signal a pulmonary embolism, which is a medical emergency.
So if you experience any of those symptoms, especially after a long flight or surgery, don't hesitate, get medical help immediately.
Absolutely, don't mess around with those.
How do doctors diagnose a DVT?
Usually it's an ultrasound with Doppler. They use sound waves to visualize blood flow and see if there's a clot.
Pretty straightforward.
It is, and highly accurate.
Now, the statistics around DVT and PE, they're pretty alarming, aren't they?
They are. It's estimated that up to 900,000 people in the U.S. could be affected by DVT or PE each year.
900,000. That's a lot.
It is, and sadly, a significant number of people die from it. The estimates are somewhere between 60,000 and 100,000 deaths annually.
That's a huge range.
It is, but it highlights the seriousness of the condition. And even if you survive, there can be long-term complications like post-thrombotic syndrome,
What's that?
chronic swelling, pain, skin discoloration, dry skin in the affected limb. It can really impact quality of life.
So it's not just about surviving the initial event.
Exactly. And there's also a significant risk of recurrence. About a third of people will have another DVT within 10 years.
Okay, that's all pretty sobering. Now, we touched on varicose veins earlier. How do they fit into the picture?
So varicose veins, they're those bulging, twisted veins, often seen in the legs. Very common, actually. Up to half of older men experience them to some degree.
And they're just a cosmetic issue, right?
Well, not always. They can cause discomfort, aching, heaviness, swelling, itching. But the good news is they're usually superficial. That they're in the veins close to the surface, not the deep veins where DVT occurs.
Okay, so not as dangerous.
Right. And treatment, it's often for cosmetic reasons or if symptoms are bothersome.
What are the options?
Sclerotherapy is a common one. They inject a solution into the vein, causing it to collapse and fade away.
Like a magic eraser for veins?
Kind of, yeah. And then there's laser treatment, which can be good for smaller veins.
So there are solutions if they become a problem.
Definitely. Now, as we wrap up our deep dive into Chapter 13, what are the key messages the authors want to leave us with?
Yeah, what are the big takeaways?
Well, they really emphasize the importance of regular physical activity, especially for vein health. Even short bursts of movement can make a difference.
So get up and move.
Exactly.
Oh.
Also, they remind us that a lot of men over 55 have reduced leg blood flow even without realizing it.
That silent PA we talked about.
Yep. And it's often linked to those common risk factors, age, smoking, high blood pressure, all that.
And they really hammer home those warning signs for DVT.
They do. Sudden swelling, pain, warmth, redness in one leg. Those are red flags, especially after a long flight or surgery.
Don't ignore those.
Absolutely not. And they make it crystal clear. A pulmonary embolism, it's a killer.
No messing around with that.
Not at all.
Well, this has been an incredible deep dive into Chapter 13. I feel like we've just scratched the surface of what's in this book.
Agreed. There's so much valuable information, all presented in a way that's easy to understand.
We highly encourage everyone listening to check out the full chapter. It's well worth your time.
It could literally save your life.
So thank you for joining us for this important discussion on circulation. We hope you've learned a lot and are feeling empowered to take charge of your circulatory health.
And be sure to tune in next time as we continue our exploration of the 21st century man.
We'll be diving into Chapter 14, which is all about lowering the risk of stroke. Another crucial topic you won't want to miss. Until then, stay healthy and keep those blood vessels happy.